If you're listening to this CD, you've requested information regarding Dr. Receveur's method of sedation dentistry. At least 9 million Americans wear dentures and 12 million are missing one jaw of teeth, and most don't even know what to do. Nearly 65 million avoid dentistry out of fear. Fortunately, there's a new method in New Albany and southern Indiana for comfortable dentistry and denture and tooth replacement thanks to Dr. Ronald Receveur. This new method is so unique that his guide, A Guide to Dental Comfort Breakthroughs, is being used by dentists in the U.S. and Canada to help patients understand these methods. If you've avoided having missing teeth replaced or going to the dentist due to anxiety, are tired of dentures, dislike dental office sounds and smells, dread sitting in the chair for hours or multiple visits, have problems getting numb, staying numb, or with gagging, have teeth so sensitive that the dental exam pick is painful, or you're simply afraid of the needle, then Dr. Receveur's sedation dentistry method is designed just for you. How does it work? One takes a special medication about an hour before coming for your appointment. We then use a carefully selected combination of FDA-approved drugs, allowing you to dream through the visit, staying virtually pain-free, and to wake up to a healthy mouth and beautiful new smile. Patients often say that it was their easiest dental visit they've ever had, with minimal to no memory of treatment, and the 3 to 4 hours seemed like only minutes.
I'm Terry Miners. Let's hear more about this wonderful way to achieve a healthy mouth and beautiful smile from Dr. Ronald Receveur and several patients who've experienced his unique method of dentistry devised to help people with serious dental problems and serious fear of going to the dentist.
Hi, I'm Dr. Receveur, and it really is great to be here with you, Terry. When you're fearful or a phobic dental patient, it really is a very serious matter. Many fearful patients have experiences with dentists where the dentist thinks being afraid is silly or just frivolous. They think the patient should just suck it up or be tough.
And I'm starting to understand more about people who are truly afraid or even frantic, Dr. Receveur. You were telling me that it's exceptionally difficult for people to pick up the phone and make that first call to your office. So explain that in more detail.
Terry, I would like to say to anyone listening that I congratulate you on calling my office. I know that the first call is the hardest and took a whole lot of courage. I really want you to know that you are not alone. Half of the entire population does not go to the dentist except for dental emergencies, say when they have a toothache or a broken tooth. For many people, sedation dentistry is a dream come true. We offer a wide range of treatment options where you can choose anywhere from a light sedation to IV sedation, where you really can sleep through your appointment. Very few offices in the state of Indiana have this capability, even though some may advertise sleep dentistry. If they advertise oral conscious sedation, they are not offering sleep dentistry. Many of my patients tell me that for years they've covered their mouth with their hands when they laugh or smile. Sometimes you'll even see men that grow long mustaches or beards to cover up their smile so they aren't embarrassed. I want to say it again. People absolutely do not need to suffer in agony and discomfort anymore thanks to rehabilitative, implant, cosmetic, and IV and oral sedation dentistry that we can offer to cure their problems.
Sedation dentistry obviously makes your patient's experience very different, so how does it do that, Dr. Receveur?
Well, a huge benefit of sedation dentistry, Terry, is that it leaves you with little or no memory of your dental visit.
So, Dr. Receveur, specifically, who is a good candidate for sedation dentistry?
Well, adults who have a lot of fear of the dentist or who had a horrible childhood experience, or maybe someone that just hates the sounds and smells of a dental office. For some people, it's the fear of the unknown, like having an implant placed which they've never had done before. With sedation dentistry, my patients never experience those things. Or perhaps it is the fear of getting shots or being around needles. Patients with bad gag reflexes do very well with sedation dentistry. People who are afraid and embarrassed about their teeth and want their teeth to look nice. Patients who want a nice smile that looks great and enhances their professional image. All of this can be accomplished with sedation dentistry.
Yeah, all this sounds really amazing. Now tell me the most common concern that you hear from your patients.
One of the biggest complaints is that previous dental experiences, the patient just couldn't get numb. The reality is that their teeth might be more sensitive than other patients, but with the techniques with IV and oral sedation, the patient is asleep and they don't know a thing.
Boy, and that's fantastic.
The second largest reason that people avoid going to the dentist is that they dread sitting in the chair for a long time or many appointments. So with sedation dentistry, I can get a lot accomplished with their treatment in just 1 or 2 visits.
Dr. Ron, are most patients afraid of hearing the bad news about their teeth?
Terry, most patients already know how serious their dental problems are. They don't want any judgmental attitude about this. They've already heard it before. Things like, I can't believe you let your teeth get this bad, or why did you wait this long? I think something worth repeating is that at my office, people are respected. I'm here to give my patients hope and give them a choice to get their dentistry done comfortably.
So tell me how sedation dentistry works. I understand that you have more training in this area than the average dentist that advertises that they do sedation dentistry. You've gone deeper into the study here, so tell me the difference.
Well, sedation dentistry is a general term that refers to the overall umbrella of combining dental treatment with some sort of sedation. Now, sedation can include nitrous oxide, oral conscious sedation, IV sedation, or general anesthesia. Some dentists may use the term sedation dentistry. It does not mean that he or she is certified in the more advanced discipline of actual sleep dentistry. Sleep dentistry refers to IV sedation or general anesthesia where the patient is actually asleep.
And so why is that distinction so important?
Well, most dentists today offer nitrous oxide. That's been around for many years. Some dentists offer oral conscious sedation. Very few dentists offer IV sedation, yet many will advertise that they offer sedation dentistry. Don't be fooled. If you're like millions of others, you'll want the care and the comfort of a full range of options.
Absolutely.
If you're really wanting sleep dentistry and feel that will give you the most comfortable dental experience, you just need to make sure that you know what's really being offered. Ask if actual IV sedation or general anesthesia dentistry will be offered.
All this sounds really amazing to me. I understand we have a few patients of yours, too, that are going to tell us about their wonderful experiences in your office.
In the past, prior to sedation dentistry, dental procedures were a nightmare for me, crying before I would even make the appointment. Now, with the sedation dentistry, I'm much more relaxed before and after the procedure as well as during.
If you're having problems with dentures or anything, you really need to go see my dentist, Dr. Ron, because he's the absolute best. He will take care of you.
While Dr. Receveur is a true advocate of compassionate dentistry and will never be judgmental toward you for staying away from the dentist for so long, the facts are clear. The longer you go without dental care, the higher your likelihood of incurring problems such as gum disease, cavities, painful biting, bad breath, and eventually being self-conscious about your smile.
Let me close by saying that I invite you to schedule an appointment to meet me and my team. When you come in, we'll determine if sedation dentistry is appropriate for you. It is for many people. We will answer all of your questions. We will go over any financial and scheduling considerations to allow you to fit the dentistry you want into your budget and to your schedule. We also have a can't go wrong guarantee with sedation dentistry consultations. I feel like our office is a special place for people to be cared for in complete comfort and respect.
Don't put it off any longer. Don't delay. Pick up the phone and call Dr. Receveur at 888-272-5031. He'll treat you with the respect you deserve. That's 888-272-5031. Call today. Then you can wake up to a healthy new smile. Go to www.newalbanysedation.com to learn more about all the extensive training Dr. Receveur has in this area and to hear his patients talk about their experiences in his office.